This lesson covers gynecology, especially pathophysiology. So we'll be looking at what goes wrong, the disease processes and such that occur in gynecology. We're going to start off by talking about pelvic inflammatory disease. Pelvic inflammatory disease with the initials PID refers to an infection. There's an infection of the female reproductive tract. Now this infection can be due to a bacteria, it can be due to something that's viral, or it can be due to something that's fungal. But anyway, this infection actually involves the associated anatomy and physiology. For example, it can affect the uterus itself. So we have things that occur there. It can occur in the fallopian tubes and also with the ovaries. So these organs are the ones that are typically involved with PID. Now, PID, pelvic inflammatory disease, is the most common cause of abdominal pain in women of childbearing years. Common causes of PID includes gonorrhea and chlamydia. So these two can be sexually transmitted. These can be STDs. And unfortunately, what happens here is that both of these can be undetected for a period of time. And then when they're finally the symptoms become so obvious and the patient becomes so sick, that's when they begin to get diagnosed. So that's called frank PID. So frank PID means it's obvious. Now PID itself has some predisposing factors. Multiple sexual partners means risk. It refers to the risk of infection. And then a prior history of PID is another thing that you may run up on, that they've had PID in the past. Sometimes when they have procedures, gynecologic procedures, it actually causes trauma and introduces infection. And then also the presence of an intrauterine device or IUD increases the risk of PID. Pelvic inflammatory disease can be either acute or chronic. So acute means it comes on suddenly or severely. Chronic is it's an ongoing condition. So the PID can actually cause a lot of problems. One of them is adhesions. Adhesions is like scarring, but those scars actually can bind organs together and cause those organs to be abnormally functioning or actually cut off things like blood supply. So adhesions are bad. They can occur secondary to trauma, secondary to surgery, or secondary to infection. Now, PID can also cause chronic pelvic pain, a constant state of pain. It can cause infertility, so it could actually prevent the conception. And then anytime you cause scarring and so on, you narrow the fallopian tubes, and that scarring can actually narrow, constrict, so you can get a fertilized egg on one side of an obstruction, and then that egg implants, and now you've got an ectopic pregnancy, or what we would call a tubal pregnancy in the old days. So patients with PID, they tend to show that they hurt, and they can actually have what they call a shuffle, and sometimes it's called a PID shuffle. And when I used to work in the emergency room, sometimes you could spot these people coming down the hall. And the reason is they shuffle is because the vibration of their heel hitting the floor jars them and causes pain. So since pain walking intensifies the pain, sometimes they tend to shuffle as they walk. Now, if they've got a really bad case, then they will look sick. They'll come in with a fever and chills. They can have nausea and vomiting. Now, they can have sepsis, but that sepsis can all go all the way to septic shock. So these people can be so sick that they end up being admitted to the hospital, and that's where this comes in down here, the antibiotics. They may be admitted to the hospital and have to be on antibiotics for days to try to get a handle on this infection. Well, they also may complain of a foul-smelling vaginal discharge. It can be yellow. And then also, when they have PID, it often results in them having abnormal menses or abnormal period. So they can actually have that. And when you look at them, sometimes when they have PID, you just look at them and they appear acutely ill. They look sick. Now, another one here is the ruptured ovarian cyst. So here we have a cyst over here, and this one is a follicular cyst. It's on the follicular area of the ovaries, and so you see that's just full of fluid. Cysts are fluid-filled pockets, and they can cause pain, and they can cause pain that is quite severe, and then also they can cause bleeding. So pain, and then also bleeding or blood inside the pelvic cavity abdomen area. So this would be hard to distinguish. In our actual dealings with the patient, you and I couldn't tell the difference between a ovarian cyst and an ectopic pregnancy. Now, ruptured ovarian cyst, they can have abdominal pain, and they can also have rebound tenderness. Now, I don't want you to do this. I'm going to tell you what rebound tenderness is. Then I'm going to tell you not to do it. So this is a no-no. So we're not going to do this. Okay? So we're not going to check for rebound tenderness. We won't do it. Okay? So what we're going to do here is you understand that rebound tenderness is that it feels better usually when it's slightly compressed. And then when you move your hand, it bounces back, and that causes rebound tenderness. So in other words, it hurts a little, but it hurts less when you push in. But when you let go and everything springs back, that's when they have their terrible, terrible pain. So that's when they hurt. So we're going to not do that. Imagine this. They've got a big old swollen cyst, and you push down on it, you can pop it. You release it, you can pop it. So we're going to stay away from that. Now, history of painful vaginal sexual intercourse, irregular bleeding, and changes in their menstrual cycle. So all of these things should make you think that it's possible that they've got something like a ruptured ovarian cyst. So there may be some vaginal bleeding, possibly. Cystitis. Now, cystitis is in gynecology, but actually it's what we call a UTI. A UTI is a urinary tract infection. And what we have to understand is that this infection actually is one that ascends. It goes up. So in other words, it comes in through the urethra, and it finds its way into the bladder. And then it can continue to rise and go to the ureters. And we can actually end up with this becoming pyelonephritis, which is kidney infection. Now, the signs of cystitis, they feel like they have to go urinate all of the time. So increased frequency. They complain of pain or burning with urination, and they often have a low-grade fever. So increased frequency, pain or burning, low-grade fever. And these people will have a hard time sitting still. Another one here is Mittelschmerz. Mittelschmerz. And you might, excuse me, you might think that that's a strange name, but of course it comes from Europe. And anyway, what it deals with is ovulation. And what happens is about mid-cycle of ovulation, they end up with abdominal pain. And this is when the follicle ruptures, and it's basically around the time it releases an egg. So what we're seeing here is pain associated with their cycle. And about all we're going to do with that is just treat them symptomatically. So we'll just treat them according to their needs. Endometritis. Now, endometritis refers to an infection. So itis usually refers to infection. So this infection is in the uterine lining. The innermost layer of the uterine lining is called the endometrium. And so this is an infection of the uterine lining. So there we go. That's why it's called endometritis. It's an infection of the endometrium. Now this happens sometimes with people who have had a miscarriage or post-childbirth. It can happen after gynecologic procedures, such as a D&C. And this endometritis can, excuse me, can result in abdominal pain and a discharge that can be bloody looking and foul smelling. And since it's an infection, fever. Now, we talked about endometritis. Now we're going to talk about endometriosis. The endometrium is the innermost lining of the uterus. Sometimes that tissue finds its way outside of the uterus, and then it attaches. It attaches inside the abdomen, it attaches inside the pelvis, and it's still controlled by hormones. So what happens is it ends up causing things like inflammation, scarring, adhesions. Oftentimes this can only be corrected surgically. And it's one of those things where sometimes the only way to control it is to do a hysterectomy. Now, this happens usually in women between the ages of 30 and 40. We don't really know why it all happens, but we know it does. The exact cause of it's unknown, but look for dull, cramping, pelvic pain. And it's related to their menstrual cycle. And sometimes it results in painful intercourse and bleeding. People who have endometriosis will usually present to the doctor, and oftentimes they present for something related to gynecology, and then it's diagnosed. So, for example, they may actually be there because they're being evaluated for infertility. Now, here is the big bad one, ectopic pregnancy. Make no doubt about it, ectopic pregnancy can kill. These people can bleed out on you. So we have to understand any woman of childbearing age who has abdominal pain, we have to worry about ectopic pregnancy. What is it? It's when the fertilized egg implants anywhere other than the uterus. If it plants inside the fallopian tubes, we used to call that a tubal pregnancy. Wherever it implants, it's a surgical emergency because when the developing fetus gets big enough, it ruptures whatever it's attached to, and then that causes massive bleeding. People with ectopic pregnancy can often have unilateral abdominal pain, kind of like appendicitis. It can radiate to the shoulder on the same side. They will often tell you something happened where they missed or had a severely abnormal light period. And if the ectopic pregnancy is in the right spot, you may have some vaginal bleeding. Remember, ectopic pregnancy is a surgical emergency, and we have to be prepared for massive bleeding and shock. Take them to a hospital that's capable of handling their surgical emergency. So this concludes pathophysiology of the gynecological system.